Hi all. Today we're going to talk about Lisfranc fractures. Yeah, I never thought it would be a topic of discussion in my life either, but come to find out, I'm freakishly obsessed with them now. I actually fractured my foot on August 31st of 2018, and I wish I had a really cool story to tell you about how I fractured my foot. But actually, it's pretty lame. I was sick. I had recently had an eye surgery and had about every side effect imaginable, and got really lightheaded. I felt dizzy. I knew I was going to pass out, so I was trying to sit down my daughter and lay down and not pass out on her. But I got her sat down and then fell, and kind of when I came to at the hospital, really the only thing I could tell them was that I had been lightheaded and that now my foot hurt. Well, because I had passed out, there were other issues that were more pressing than my foot. And so they dealt with those first and sent me home. They didn't do a foot x-ray. They felt like it was probably not that big of a deal. And so they told me just ice and elevate it and it should get better and no worries. We focused on everything else. So come to find out it didn't get better. It continued to swell even with ice and elevation. In fact, it kind of turned into a monster foot. It was disgusting. I sent a couple friends and my sister a text and was like, what in the heck? It is a monster foot. And I'm going to share pictures with you guys that are pretty nasty. So I'm guessing if you're watching this video, you have a Lisfranc fracture, so you know that they get pretty gross. So I'll share my gross pictures with you and you can share yours with mine. But 5 days went by. No, actually, 3 days went by, and my stepdad came to my house and saw my foot and said, absolutely not. You're not waiting until the doctor's office opens. You're going back to the ER. So back to the ER I went, and the doctor looked at it, and he felt like it was probably an infection, like cellulitis or something. So they admitted me to the hospital and started IV antibiotics. And after a couple days of those, it still wasn't any better. In fact, it was just continuing to swell and get grosser. And so they did an x-ray and came back that not only was my foot just broken, but it was a Lisfranc fracture, which is a pretty significant injury to the foot. And so the orthopedic surgeon came and met with me. And in my hometown, they do a lot of orthopedic surgeries and do a great job of those. But I am diabetic, and I had been walking on the fractured foot for 5 days. My fracture is pretty severe. I fractured the bone, ligaments and tendons were ruptured, and I had the dislocation of 4 metatarsals, which is the fancy word for toes. So my toes were going to the left, and my mid bone was going to the right. So that's part of why it looks so gross. It was just really deformed. And the surgeon at home felt like it was something that, with my diabetes and the complications, that I really needed to go see an orthopedic specialist out of town and have the surgery done there. He felt like it would be a safer bet. The first surgeon I met with originally told me worst case scenario was I would lose my foot, and best case scenario was I would walk with a limp and have lifelong pain. So neither one of those sounded incredibly wonderful, and everything I was reading online didn't sound optimistic. So I was game for getting out of town and trying to find someone that maybe could help minimize the risks. So we met with a surgeon out of town, and he took a look at it and said it was way too swollen to do any surgery on right away. So he sent me home in that dreaded boot and said, we're going to wait 2 weeks. So 2 weeks of non-weight bearing and kind of prep for surgery. In hindsight, I'm really glad I had that time because I had a lot of preparation to do. I'm a single mom with 2 little kids, well, a 10-year-old and an 8-month-old, and I knew I was going to need a ton of help. I also knew I was living in a 3rd floor apartment, and navigating 3 flights of stairs with a baby and crutches and non-weight bearing just seemed really insurmountable to me. So the time between surgery or the time between injury and surgery gave me a chance to find us a new place to live. So I rapidly made those plans, and actually the day of surgery, my wonderful friends took care of my kiddos and got us moved. So when I came home, our new home, there's a few steps to get in, but then everything's on the main floor, and those few steps just seemed so much more bearable than 30 steps. I'm a mess on crutches, we found out right away. So also before surgery, I got a knee scooter ordered that I highly recommend you go ahead and invest in. Lisfranc fractures are typically non-weight bearing for 6 to 8 weeks. That's a long time to do crutches. So, take the time, invest in the scooter. That's my one big advice. And I'll actually share the link in the description of this video for where I got my scooter and what kind I have. I looked at renting one from medical supply places, and it was going to be cheaper actually to buy one than to rent one for the 2 months that I knew I was going to need it. So that was the option I went with. I also really took the time to work with my friends on like a care calendar of people that could help us with transporting my daughter to daycare, helping with the kiddos in the evening if I needed it, helping with meals. It was really helpful to have the time to prepare and know that my kids were going to be taken care of rather than the stress of just going right into surgery. So I do feel like the wait time was good in that regards. It was a little stressful because I knew the longer we went from injury, the more chances of complications. So, I would just really encourage you. My guess is if you're watching this, you have just been injured. And I would say first step, find yourself the best surgeon you can find. It needs to be someone you're comfortable with, someone that you believe in and that listens to you and communicates well with you. The next step would be get prepared. And, the third would be just to really try and take the time to make sure that right before surgery you're well hydrated, you're not sick, you're well rested. All of that is going to help you. So, that's kind of what I did. Right now, I'm about 2 weeks post-op, and I'm going to share some additional videos with you about the process and kind of how this has gone. I'll share about surgery and my recovery. So, but really, I just hope that this kind of helps you know that you're not alone and that so much of the information I read online was so negative about this injury. And I know there could be a lot of complications. I know this is a significant injury, but there's also hope and there's lots of options out there. And my hope is that people don't feel as doom and gloom as I felt in those first few days when, they talk about how this is a career-ending injury if you're an athlete and how, you can have lifelong pain and how horrible the recovery process is. And I just haven't so far found that to be the case. And so I encourage you, to stay positive. While you're waiting, make sure you keep it iced and elevated. The less swollen it is at surgery time, the better. Rest, take care of you the best you can, and just hang in there. It's going to be okay. You're going to get through this. You really have no other choice. This is where you're at right now. You have a broken foot, you have a Lisfranc fracture, and now we just got to get well. So check out my other videos and you'll see how I'm recovering. But so far, so good. And just know you're not alone. Always feel free to message me if you have questions. I'm always happy to chat, especially, in the middle of the day or the middle of the night, because I really have nothing going on. I'm just elevating. Hang in there.